And a good Monday morning to you. Happy Labor Day. It is the 4th of September. We are live to the KGNS app. I just sent out the notification. We're live to the website as well at KGNS.TV. And we're live to our Facebook page and to our YouTube channel on this Monday morning. Thank you so much for being with us. Programming-wise, everything is regular schedule. Many people may be off today, but the news continues. So I'll see you on KGNS News at noon. We do have Telemundo en Tu Casa before that at 11 o'clock this morning. Right now, we're going to talk about, well, we just started the month of September, and every month there's several national celebrations, national awareness campaigns. As September, one of the awareness campaigns is for suicide awareness. And so we're going to talk about that with Julie Bazan. Julie Bazan is the Executive Director of the Area Health Education Center. And then we have Maria Sanchez. She is the Executive Director for Border Region Behavioral Health Center. They both know a lot about this topic, and so we'll talk about that with both of them. Julie, Maria, welcome to the Digital News Desk. How are you?
Good morning, Ruben. Thank you for having us.
Thank you so much for inviting us today.
Maria, thank you. Julie, thank you. Where do we start? This is such an important topic. And I know, Julie, that you, over the last year, have been at the forefront of a campaign to raise awareness on this topic. So what changes now for this month of September in your role?
I will tell you that the Laredo Suicide Awareness and Prevention Coalition has been working very hard at creating awareness about the fact that 988 is a national suicide and crisis line that can be accessed 24 hours a day, 7 days a week in English and Spanish. That has been our mission since the beginning of this campaign, Ruben. But because September is Suicide Awareness Month, as a coalition, we came together and said, let's create more awareness, not just about the national number, but the resources that we have in our community, so people know that they're not alone. And Maria Sanchez is one of our coalition members, and so she's here about that.
Before I ask you any questions, Marisa, Maria, sorry. From either one of you, any numbers yet on how 988 has helped, if at all, in this campaign to help people that are considering suicide? It was just fairly recently launched. The 1-800 number had been around for so long.
Right.
Any numbers yet, Julie, as to how this has gone?
I can tell you that the numbers have increased, the calls to 988. And you're right, the number launched in July of 2022, and not many people knew about it. And this is why the initiative was to create awareness so that people could see that there was a resource. And you know what's more important and beautiful about this resource, that people can text or chat. They don't have to necessarily call, but the calls to that number have increased, and we're currently requesting information on that data so that we can share it with you.
Maria, how has Border Region utilized that number to assist the clients that you have?
That number for Border Region is just another number, and a very important number that the community can use. You know, Border Region has always been around, for many, many years, well over 40, 50 years, and provided information about suicide awareness and about suicide prevention. In addition to that, we have, of course, the crisis line, which is 1-800-643-1102. And of course, the main number is 794-3000. And so what it does, it works in conjunction with the 988 number, and of course, provides referrals to Border Region for any services that are needed.
Let's talk about suicide itself. Such a taboo topic at times. Maria, as the Executive Director for the Behavioral Health Center, talk about the importance of education when it comes to suicide.
Well, no, there has been a myth that if you speak about suicide, then you would prompt someone to actually commit suicide, okay? But that has proven that it's not true. The more you talk about it, the better it is for people to express their feelings and to speak to someone, you know, hopefully a friend, a professional, about their thoughts of possible suicide. And so that makes a big difference because, you know, the norm has been to, you know, keep it all inside you. Of course, in our culture, you know, we keep everything inside us, and we don't talk about that. So when it comes to suicide, it has been proven that the more you talk about it, the better. And even just asking someone, How are you doing today? How are you? You know, what are your thoughts? That is preventive in itself.
So the approach is different, or you've learned that it's changed, and it's actually important to talk about it and not be scared about causing someone to actually die by suicide.
Correct. You know, there's always been a stigma with mental health.
Yeah.
And like I said, even more so in our culture, because we're very tight-lipped about it, and we don't, want to let anyone know what's going on within our families. But, Border Region has been there and provides many services. And we have services for adults and for children, where we see more of an impact, where the awareness is now so that people do come to Border Region. Our numbers have increased by so many fold. I mean, our numbers for adults, our children numbers have almost reached the same as the adult numbers. We serve over 2,400 adults, and the children are getting up to that number as well. For Border Region, we serve over 8,000 clients in one given year, and that's just unduplicated numbers. And those are the clients that come in, and they come repeatedly to Border Region to access services.
And that's not just in Webb County. That is now in other counties as
Correct.
well.
Border Region provides services in Webb County, in Zapata County, Jim Hall County, and also in Starr County.
And there's work going on in Zapata is there works on a new facility there in Zapata?
Yes, sir. Yes, we have purchased a property. Border Region has purchased a property, and in the process of getting that property built for a brand new location. And also, there's a house there who provides services for our clients as well.
Now, Border Region, there's also the Casa Amistad. Is that fairly new as well?
Casa Amistad has been around for a long time, up until 2 years ago or so. Casa Amistad, as we call it, was part of San Antonio State Hospital. It was an extension. We proposed that Border Region acquire that particular building, and now it's a crisis stabilization unit. And what it does, it has the ability to house 10 individuals, 5 male, 5 female, and those are for crisis services, to stabilize them so that they can later go on into the community, hopefully, and be productive members of society, of course. But what happens with Casa Amistad is that we assess them, and then they get counseling, they get psychiatric services, and all within the community. And that's what's important. When you provide services for the community, there's support of family members or support of friends, and they don't have to travel outside. And a stabilization unit such as Casa Amistad, we have the ability to keep the clients there or a maximum of 14 days. Most of the time it requires 3 to 5 days for them to be stable. And then if the clients cannot be at Casa Amistad because they have additional services that are needed that cannot be provided there, then what we do is we send them, transport them with the help of the county to other psychiatric facilities, psychiatric hospitals. But the difference being is that those are outside, for example, in Edinburgh, they're in San Antonio. So when we're able to place them at Casa Amistad, they stay within the community and treatment is faster.
Yeah. And it's not per se a psychiatric hospital, it's a stabilization unit, so that you said 14 days max, you try to treat them in that brief amount of time with the intention of not having to send them out. And if you have to, then you have to.
Correct.
Julie Bazan and Maria Sanchez are joining us this morning. Julie is the Executive Director for AHEC. Maria Sanchez is the Executive Director for Border Region Behavioral Health Center. September is National Suicide Awareness Month. How does AHEC play a role in all of this, Julie, the Area Health Education
So the
Center?
Area Health Education Center, with a mission to increase the number of providers in the region and thus improve the quality of life for the residents, is very much involved in anything that impacts the quality of life for residents. And education and awareness is something that is part of our mission. And so creating awareness and educating the community about the resources available for people needing help during crisis, and also to decrease the number of suicides in our community is very important, because you cannot do well in receiving a good education unless you are well physically and mentally. And so this is something that impacts every resident. We've seen several studies that have said that the COVID-19 pandemic has impacted 90% of the population. So at different levels, right? So why is it that we're here today? To educate the community that there are resources to reach out for help and to not be embarrassed. We say it's okay not to be okay.
Yeah.
And reaching out for help is a sign that you are really trying to do better for you, for your family, and the people around you.
Yeah, and for those that do experience, have an experience with it, to share that with others. I know that's what I do, because people need to hear, hey, wait a minute, I'm not the only one going through it. Because when you're in that state of mind, and I know for a fact, you feel like you're the only one going through that, and that's false.
It is false, and people feel if I ask for help, they're going to think I'm weak, that I'm this, that I'm that. The imposter syndrome is very prevalent, and we need to get rid of that and tell our loved ones. And I tell people, our coworkers, make this topic part of your conversation at dinner, at lunch, when you gather with your friends. Talk about 988 or other resources in the community. The reason why I say 988, because you can access it 24/7, bilingual chat, text. But any kind of help that you reach out for is great.
Well, and 988 is a conversation starter in and of itself.
Right.
Maybe they don't use it, but now you've started a conversation with this person about their mental health, about their mental well-being, and perhaps just talking to them about this number could lead to getting them other help. But it's such a great tool, the 988, because it just makes it that much easier for those who have no, and you don't need to be on the verge of suicide to call that number. If you're having any sort of crisis, you call that number and someone's going to be on that other end.
And
correct?
Ruben, one thing to remember is that what's a crisis for me might not be a crisis for you. So there's different levels. Don't ask yourself, is this really a crisis, or should I just deal with it? Call or text or chat.
And don't compare yourself to other people, because like you just said, everybody else has a different crisis. They may perceive something as a crisis. So you just make the call and just worry about yourself and not everybody else. Maria, I know you've got an event coming up soon, and I know you do too, Julie, but we'll talk about Maria's, because hers is this coming Wednesday, is that right?
Oh, that would be Julie's.
Oh, that's yours, Julie?
It belongs to the coalition.
Goodness gracious, okay.
Let me just tell you about Wednesday, which is September the 6th. We are doing a joint proclamation with the County Judge Tijerina and also our Mayor, Dr. Trevino. It will be at the City of Laredo Health Department on Cedar, and the proclamation will occur at 11. We will also do a walk, and the walk begins earlier at 10 o'clock. And the walk is to create awareness. We're not out there to walk 5 miles or a marathon. We're just there to create awareness, to bring everybody together in the community, to show you that we care, that somebody cares about you. And I know that there will be different agencies that provide mental health services there, displaying their information and methods how you can register to receive services.
So this is this Wednesday, and the health fair is from 10 to 12. There's the flyer.
Yes.
At the health department, which is at 2600 Cedar, plus the proclamation at 11 o'clock and a small walk.
Correct.
Join us. It's a walk for hope. For suicide prevention awareness. Any other activities that you have, Julie? And then I'll get to you, Maria.
So,
I have the right flyer. I have the wrong person.
Yes. And then on Friday, we have a virtual mental health awareness presentation, and this occurs every 2 weeks. This is virtual, and if you would like to attend, of course, call the Area Health Education Center 712-0037 to register. The topic is suicide awareness and mood disorders, and this will be something very important to share with your loved ones. And this occurs every 2 weeks. It's a topic on mental health every 2 weeks throughout the year, so we invite everyone.
Mirtala Alejo will be the guest speaker.
Correct.
Very well-known counselor here in town. I'm going to zoom in on that QR code, leave it there just for a little bit. If anybody wants to register, it is absolutely free, right?
Exactly. It is free, and for social workers and counselors, they receive 1 hour continuing education credits at no cost.
And you're saying these happen every 2 weeks then?
Correct.
Okay, so this is this Friday, 1:30 to 2:30. There's also an email there and an email address and a phone number if anybody wants to call. Let me zoom out, and then what else do you have going on, Julie?
Of course, we have several people are doing different things at their sites as far as creating more awareness by encouraging their clients. Remember that the coalition, composed of many agencies in the community, is doing different things within their units so that nobody goes without realizing that 988 exists.
Yeah. Maria, you're having a walk as well. Yours will be in September, well, this month, obviously, but this will be on September the 16th, correct? Tell us about this.
That's correct. We're having a walk on September the 16th. It starts at 8 o'clock in the morning. And then after that, after we come back, then we'll have a health fair. And normally the health fair has a lot of partners from the community providing information about their services. Of course, AHEC will be there. We usually have Gateway, we have Pillar, we have Scan. We have quite a few partners that also provide additional services, in addition to Border Region that we partner with, just all the time.
Yeah. And so the registration is at 7 o'clock in the morning. The walk is at 8. There is a $10 fee, but that includes an official T-shirt.
Right. If you want a T-shirt, then you pay your $10. If you don't want a T-shirt, then you don't have to pay anything. That's
Gotcha.
correct.
And there are volunteer opportunities, community
Yes,
service hours,
community
Maria?
service hours, 25 community service hours for anyone that wants to come and help. In the past, we've had the high schools come, and we've had the colleges come, and they are very eager to get community service hours.
All right, so September the 16th, and I'm going to zoom in because there's a number on this for Laura Cortez. If you want to give a call to that number, 794-3130. You can also email Laura Kim. She is blauraK@borderregion.org. Anything else either of you wants to mention about Suicide Awareness Month?
Every life matters, right? It doesn't matter what you're going through. Please know that there's someone out there to help you, to assist you, to guide you, to listen to what you have to say. But I don't want to end today's event without giving some acknowledgement to our first responders, the City of Laredo Police Department and the Fire Department, and of course the Webb County Sheriff's Office, because they were the first ones at the scene always, and because of them we're able to identify the statistics locally and then continue our message so that we can reduce those numbers. They are at the forefront, they bring us the information, they're part of the coalition, and we are here together to create awareness.
And they get trained as well.
That is correct.
I know that Border Region, you do some trainings with the Sheriff's Office and with
Yes.
other law enforcement, correct?
That's correct.
And so they, because they are the ones that need to know, because they're the ones, as you mentioned, Julie, on the front line. Maria, any final thoughts this morning?
Yes, I'd like to say a couple of things.
Sure.
First of all, thank you, for having us here
Absolutely.
today. But I'd also like to tell you that we provide mental health first aid, and that's to the universities. Now, Senator Zaffarini sponsored a House Bill 2059 that provides education, mental health first aid to universities, to schools that are free of charge. Border Region and AHEC provides those trainings. And also wanted to let you know that we have some employees that go out in the community, our community healthcare workers, that go and seek out clients where they are. They go to bridges, they go to the underpasses, they go to the streets, and they provide hygiene kits, and they provide also Narcan. And that has already saved lives.
Wow.
So, and of course, that's very impactful. That's as a result of a grant that we received from the state. And so, they go anywhere that they're needed. And we know that has really helped so much this year already. Last year they made 1,500 contacts. This year they've made 3,500 contacts already.
Wow.
So, we just wanted to let you know, and I wanted to just acknowledge the Border Region employees as to all that they do and thank them, and also to remind them, I tell them all the time, that they save lives.
Well,
Okay.
absolutely. Amen to that. And it's important because you don't just sit back and say, hey, come to us, we're here, come find us. You go out
Absolutely.
and help the community by finding them as well and assisting them. So
Yes.
amazing work by both of you as always. God
Thank
bless you,
you.
Julie. God bless you, Maria. Give you one last chance. Any final thoughts?
Just thank you to the entire coalition, because without you, we would not be here today, and together we will continue to do great things. And all of the agencies that form part of the coalition are a lot, too many to mention, and I don't want to leave anybody out, but thank you, because we are blessed in this community to have caring individuals that really care about other people, and that's what makes us successful.
No, absolutely. Maria?
Don't forget that you are not alone. Call 988, call 1-800-643-1102, or 794-3000.
And a perfect opportunity to learn more at either the walk on the 6th at the health department, starting at 10 o'clock in the morning with the health fair, and then on the 16th at Border Region, that one starts earlier with registration at 7, the walk at 8, and also a lot of information at both of these events. So if you want to find out more on this topic, then definitely go to one of those events. Thank you both. God bless you.
Thank you.
Thank you.
All right, I gotta go. We have KGNS News at noon. I'll see you then. We also have Telemundo en Tu Casa coming up in about 30 minutes or so. So thanks for watching and have yourselves a blessed rest of your day.